Hi, this is Dr. Mahadevan, and we're going to continue with Basic Life Support and Airway Management Part 2. As we mentioned in our prior lecture, once we determined that a patient was unresponsive, the next step is to check for a pulse. And then, depending on what we find, that determines what we'll do next. If the patient has a pulse, then the next step after that is to provide ventilations. So let's talk about that. If they have a pulse, you're going to provide ventilations. And what that means is you're going to provide rescue breathing without chest compressions. How do we do that? If you're talking about an adult patient, we're going to give 10 to 12 rescue breaths every minute. That is, one breath every 5 to 6 seconds. When taking into account pediatric patients, we're going to give 12 to 20 breaths per minute, or that is the equivalent of one breath every 3 to 5 seconds. So for adults, one breath every 5 to 6 seconds. For kids, one breath every 3 to 5 seconds. And then we're going to do these cycles of 2 minutes and reassess the patient every 2 minutes to see if their condition has changed. One of two things is going to happen. If they have a pulse, they may lose their pulse, or if they have a pulse and you're providing ventilations, they may awaken or continue in the same condition. So we don't want to just continue giving breaths. We want to make sure that they haven't lost their pulse, or we want to check their condition to see if they're in the same condition or if they're getting better and they're awakening with ventilations. If you check for a pulse and the patient does not have a pulse or the pulse is absent, then you're going to provide compressions and ventilations. So what does that look like? If the pulse is absent, it's not only ventilations, but also chest compressions as well. So when we're giving chest compressions, the adage or the principle is to push hard and to push fast. We often don't give chest compressions fast enough. You're going to compress the lower half of the sternum to a depth of about 2 inches or 5 centimeters. And you're going to allow the chest to completely recoil and take the same amount of time for both chest compression and relaxation. So let's take a look at this patient who's going to get chest compressions, and let me know what you think about her chest compressions. Do you think that they are deep enough? Are they fast enough? Is she in the right location? Well, let me show you how they should be done when they're done properly. The first step is going to be to place the heel of your hand in the center of the patient's chest. And then you're going to place the heel of your second hand on top of the first and interlock your fingers. And then, this is very important, you're going to want to position yourself vertically above the victim's chest with your arms straight and push straight down to achieve maximal force and maximal compressions. Very different than what we saw in the prior episode of chest compressions, where the lady was off to the side, not going very fast and not going very deep. So she wasn't properly positioned. When the pulse is absent and you're providing both compressions and ventilations, your compression rate is going to be 100 chest compressions a minute. And you're going to give these in cycles of 30 compressions to 2 breaths or 2 ventilations. We're going to do 5 cycles over 2 minutes and then reassess the patient to see what their condition is. When giving chest compressions again, if done properly, you actually get a pulse with each chest compression, and that's because properly done chest compressions can achieve a systolic blood pressure of anywhere from 60 to 80 millimeters of mercury. So you're giving the patient a pulse back. And so it's very important not to interrupt chest compressions for too long to take care of other activities. They should be your priority. And keep in mind, if you're giving chest compressions, even for a duration of 2 minutes, it's easy to get tired. So if there's another person available, alternate every 2 minutes. So you're alternating responsibility for giving chest compressions between the 2 providers, or additional providers if you have access to them. So in review, if we have an unresponsive patient and we check for a pulse and a pulse is present, we're only going to give ventilations. If we have an unresponsive patient and we check for a pulse and there's no pulse, then we're going to give chest compressions and ventilations. Remember, chest compressions at a rate of 100 per minute. We're going to give cycles of 30 compressions to 2 ventilations, and we're going to give 5 cycles every 2 minutes and then reassess. Thank you for your attention.